Hi, everyone. Welcome to today's Student-Led Journal Club series. I ask that everyone please stay muted for the presentation and save your questions for the end. Today, I'll be introducing student Dr. Bishop. Student Dr. Bishop is a third-year student at Kansas City University. He has a master's in Biomedical Science, an MBA, and is currently doing a dual degree for a master's in Bioethics. He is interested in neurosurgery, music therapy, as well as medical and socioeconomic ethics. Student Dr. Bishop will be the first doctor in his family and is grateful for every opportunity that comes his way. So without further ado, take it away.
All right, well, thank you for that amazing introduction. And I also want to thank everyone for joining me. These two subjects, neuroscience and music, are extremely, I guess, subjects that I personally love. And so thank you all for joining me on this. And I hope you get as much out of it as I've gotten out of it. And so without any further ado, I do want to introduce what this journal is about. And so this specific study addresses music in combination with dyslexia and using music as a therapeutic tool to help dyslexic individuals. And before I kind of get into the actual study, I want to give a little background on what brought this study forward, the history behind why these two different topics were brought together and why music was thought of as a possible therapy for dyslexia. So let's move on to what dyslexia actually is. Dyslexia is a developmental learning disorder that gives a person a deficit when they're trying to read, write, or understand different symbols. And it's in the absence of any other neurological damage. And contrary to popular belief, it's not associated with a lower IQ or lower intelligence. It tends to run in families. And because of the social interactions that a person might have, they're more prone to develop things such as anxiety or depression. And this can really, I guess, alter the way that they live their lives. And it's something that I really didn't think about much until I started reading about this. You know, for people that can't recognize the patterns of the language that they speak or the language that they're reading every day, it really hinders their ability to live their own life. And there are many things that we can do about it, but nothing's really set in stone to truly help a person. And so I've personally heard that most people will just find their own way of dealing with it, but they keep it secret. And what we think is a possible cause to this is temporal processing. Now, temporal processing is the processing of acoustic stimuli over time. So when you hear something, the way your brain will process this in time, the syllable speed, the phoneme recognition, being able to pick apart words and parts of words as they're spoken or written, and the way that your brain is able to do this. So the theory is, you know, if you have an auditory temporal processing deficit following the chart, then you have segmented phonological representation, and this leads to higher problems with syntax and semantics. And most people believe that this temporal processing has a certain speed that you can, I guess, pick apart this deficit at. And you've had people such as Hornicle and Krauss in 2013 that thought this was 600 hertz. Goswami, who thought it was between 2 to 50 hertz. And so this variable speed, many people try to find where this was, but overall, after many studies were done, it was found that this speed was actually just all over the place. It's not one area where the temporal deficit sits. It's actually just broad. And so that leads us to the cause of how music can actually interact with this process. And so let's discover what music is. Music is an ancient concept in human history that existed across all civilizations. And it reflects the history, the culture, the ideas, the context, and even the language of a society. So looking at songs, you can see the culture within it. When I was first I guess, studying my undergrad degree, which is the bachelor's in saxophone performance, I went to my professor and I told him I wanted to play a piece called Brilliance, and it was written by a composer named Ida Gotkovsky, and she was a French composer. And he told me that this would be an extremely hard piece to learn. And he said the reason is women tend to write with an extreme, powerful passion. And then couple that with the fluidity of the French language, I found myself learning ways to manipulate the saxophone that I had never done before. And it really is something you can listen to a piece and you can hear the language in the piece. If you if you play something by a German composer, you can hear the tones, the tongue, and the starts and stops of the sounds. With French, you can hear how fluid it is and how much it keeps moving without jumping all over the place. And so there really is an aspect of culture and language within the music that you actually hear. And with this, we can see that with music being such a fluid structure, this can present a huge problem when you're trying to study it under the guise of neuroscience, because you need something a little bit concrete to be able to apply it to science itself. And that brings us to musicality. Musicality is essentially the innate elements that's present in all of music. Music can change with culture, but the elements of music are always there. Time, sound, even the absence of sound is a part of music. I believe it was John Cage wrote a piece called 4 minutes and 33 seconds. That is 4 minutes and 33 seconds of absolute silence. And that is a piece. He wrote another piece, I don't remember the name of it, but you set up radios and you play it. So you play all of these radios together. So every single time you play this piece, it's different, but it's music and it's always something different. And you have things such as pitch. And what we found that these all have a unique interaction with the brain, and music itself can activate different areas of the brain, not just the auditory cortex. And pitch itself is an extremely unique one that I kind of want to point out, because as we listen to music, if I were to hum Happy Birthday in the key of C right now, and then immediately hum it in the key of F sharp, none of the notes would be the same, but you all would know that it's the same song. And as simple as that seems, it's not unique, or that is unique to humans. It's not unique to the entire animal kingdom. And there have been many experiments that have looked at, whether you can play a rhythm or a pattern in one collection of pictures or in one key, change it, and if animals will be able to recognize it. And most of them can't, and humans do. And this is also a reason some believe that why this developed in humans, because of the need to understand language from different people. I can speak, and then I can ask a woman to speak who has a much higher voice than me, but regardless of the pitch or the timbre change, you will understand the words because you can understand the pattern regardless of the changes in pitch. Now, as I spoke earlier, we can see that music and musicality really affect the brain in many ways. So I want to give an idea of how it can actually affect the brain. So you can look at maybe, I guess music can activate some of the auditory cortexes. And I don't think you can, there was a picture that I had up here, but apparently it's not showing up, and I apologize, everyone. But music can affect the auditory cortex, and it can affect the parietal, the temporal, the frontal, visual, movement. All of these different areas of the brain are activated when you hear music. The brain stem is able to communicate with the cortex, and ironically enough, the cortex can communicate back, and that alters our perception of what we actually hear. So when we are hearing something, I like to think of it as, if I'm in a certain mood, I listen to certain songs because I'm going to get an experience out of it that I might not get when I feel a different way. And there are so many different things that music has shown to actually elevate in the human brain for those that are musically trained, including reading and vocabulary, the interpretation of pitch changes, which is an integral part of like tonal languages, especially something like Mandarin, where the actual meaning of the word will change depending on the way that you I guess, shape the pitch of the word. There's an increase in verbal intelligence. There's more processing of linguistic sounds by the brainstem, and overall increased activity of the auditory cortex. And so we don't truly understand how all of this works, but we do have a prevailing hypothesis as to that tries to explain how this works. And it's kind of the center of not only this study, but many other studies. And that hypothesis is the precise auditory timing hypothesis. And it's a connection between sound, motion, time. And so it's the thought that musical training provides musicians with an increased perception of timing and speech due to the high amount of audiomotor timing required to write and play music. As playing saxophone, I do have to time my tongue, my fingers, my air, diaphragm muscles, all with music. And when you first start playing a piece, it's all just about trying to get the time in your fingers behind something. And then after you've done that, you start to introduce other areas of, I guess, musicality to it. You start to introduce more feeling, more nuances that you can find in the language or the culture. And so most of these studies have all built on the path hypothesis, including this one, which brings us to our current study. Now, the current study is one of the first studies that was a randomized controlled trial that directly addressed music and dyslexia in kind of a therapeutic role. It ran from January of 2007 until August of 2011. And while other studies had really looked at the correlation and cause of disease or of the disorder dyslexia and how music affected the brain, this was one of the first trials that looked to see whether music could be a therapeutic tool for neurological disorders. And so, as we discussed earlier, music is a very fluid, I guess, a concept within the world, depending on where you are and time. So there was this very stringent setup of the study design to help kind of decrease as many biases as possible. And the way that was set up is there were the inclusion criteria included children that range from ages 8 to 11. And they were all clinically diagnosed with dyslexia and lived in Trieste or Rome. And they were all sent to 3 different institutions for treatment. Now, to be included in the study, they all had to speak Italian natively. They had to fail 2 or 3 standardized tests for their grade. There was an IQ requirement, and they had to have no other neurological disorders or deficits. And this was kind of spread out through an initial interview, and then again through a neuropsychological assessment that further brought down the number of participating students or children. And once they were selected, there was a baseline test given to assess the neuropsychological variables that were measured for the study. This kind of introduces their entire design, which was a test, rehabilitation, and a retest. And so once there was a testing and the baseline was calculated, each of the participants were split into 2 groups, a music group and a group that focused on painting. And so there was no control group that received nothing. And so I would think that both groups were expected to have some type of change within from their baseline. And again, in order to try to remove any types of variables with the training that was given to each of the children, each group received professional training from 2 different teachers for a specific amount of time. The music group had professional training from 2 professional teachers that went to an intensive workshop to study the Kodali and Orff method. And this focused on rhythm and temporal processing, 2 hours 2 hours a week for 7 months, including 20 minutes at home every day with their parents. And this was updated weekly so that everyone was following the same protocol. The painting group, the same thing, 2 hours a week for 7 months, 2 professional teachers that were all trained in the Bruno Munari method. And here you can see a painting by Bruno Munari. And this type of study focused on visual, spatial, and hand skills. So we've talked about the neuropsychological variables that they measured, and to give an idea of what they wanted to measure, general cognition included things such as an IQ scale using a Western intelligence scale for children, rhythm, reading, tonal length, which is trying to ascertain the longest tone out of three sounds down to the millisecond. Self-esteem, because as we discussed, dyslexia is a huge part of a person's life and it can lead to many other disorders. And the biggest one that they chose to look at were pseudo words. To explain what a pseudo word is, a phoneme in any language is the smallest sound that you can make in a language that doesn't necessarily have a meaning, but it is legible and you can produce it. And so some examples of phonemes would be sep, lep, gangit. Each of these, they're words that are legible. You can read them just as easily as any other word in the English language, but they have no meaning alone. And so the primary variable, which was pseudo word, and specifically pseudo word accuracy. And the reason this is because pseudo words in many languages is used to predict the literary achievement that one person might achieve later in life. And so that was the primary variable that was chosen for this study. Secondary variables focused on many of the other things that we pointed out, such as the reading and word, text, blending, tasks, auditory attention, tapping, rhythmic reproduction. But the main one that they did want to look at was the pseudo word accuracy. How accurate could a student be when dealing with pseudo words? And so now we'll take a look at the results. And there was an increase in favor of the music group using a 2-step multiple regression analysis. The music group tended to prevail a lot in accuracy. There was pseudo word accuracy, their primary variable. There was a significant increase. Rhythmic reproduction, the phonemic blending, which again is those small syllabic sounds that you can make within a language. All of these had an increase in the music group in accuracy. Ironically enough, where there was no significant increase were most of the areas that dealt with speed. So between the music and the painting group, there really was no difference when it came to the speed of these same areas. And it seems a little bit odd, but I'm thinking that accuracy is a higher tell of whether a person is able to produce something than speed. And speed might come later. It's a variable that I can't comment on, but it's something that could be looked at. And for those of you that are visually inclined, such as myself, here's a visual representation to kind of show that change. You have your test, your rehabilitation, and your retest, and you can see the phonemic blending and the rhythmic reproduction and the increase in the music group over the painting group. For reference, the dotted line is the music group and the solid line is the painting group. And again, as much as I enjoy this study and what it could represent for medicine and neuropsychological disorders, no study is perfect. And so there's always things that can be improved upon with any study. And that brings me to the limits of this study itself. First, I want to point out the high comorbidity. As you saw before, the number of participants started at 225, and using the first interview as well as the neuropsychological assessment, that dropped all the way down to 48 participants, and 2 weren't able to finish. So only 46 children were able to finish it. But of the initial 225, after the initial interview, you had 142 left. And then with the second drop, 21 of those were specifically because of comorbidities. And so there's a high amount of comorbidity with dyslexic children. And so that makes this a very hard trial to set up, especially since it was a 4-year randomized control trial, which that's not cheap in itself, and it's very work heavy for the people that are in it. Second, I want to talk about the rhythmic tapping. There was an increase in rhythmic tapping in both groups. And so it kind of leaves us as to, you know, what's the real reason that the change in both groups had a significant increase, but they were almost equal in a sense. Now I know that the music group focused on rhythm and time, and a painting group focused on visual spatial and hand skills. And so potentially the fact that both of them were working on something that dealt with motor activity, which would fall again under the path hypothesis, was the reason that there was an increase in the amount of rhythmic tapping, or the accuracy of their rhythmic tapping. And the last thing that I want to bring up as far as a limit was that there was no significant increase in the musical meter within the music group. Even though they were studying music and receiving musical training, their ability to understand musical meter had no increase. And it seems a little odd, but there is a difference between rhythm and musical meter. Rhythm is something that can be understood without a true understanding of musical meter. Rhythm is, I can teach you that, and as long as you can follow my pattern, you can find the rhythm. Musical meter is a little bit more complex. If you look on the screen, it could be simple or it could be compound. Simple 4/4, the second from the bottom, it's just counting the 4. But a compound quadruple, such as the 12/8, is they have it set there is 4 groups of 3/8 notes. I could break this up into any amount of counting as long as those 8 notes equal count up to 12. If I had an 8/8, which is the same amount of time as a 4/4 time signature, I could count it as 1, 2, 3, 1, 2, 3, 1, 2, 1, 2, 3, 1, 2, 3, 1, 2. And I could stand right next to somebody who is simply going 1, 2, 3, 4. The time between those two are the same, but the musical meters are completely different. And those they're kind of addressed differently, but I kind of wanted to give an explanation as to the difference between rhythm and musical meter, and as a possible understanding of why they are different. I can't say that's the reason that there is a difference, but it is just a higher understanding of why they could be seen as different. Now, what can we deem from this study? I do believe that this study does support the hypothesis that the researchers went out to, I guess, test. There is a connection between music and temporal processing, as well as phonologic processing, especially even in dyslexic patients. And this also supports the relationship between rhythmic processing and language. And so we can see that there's so much more that can be gained from studying music, dealing with neurological disorders. And we might be able to open up an entirely new area of therapy for patients such as dementia patients or dyslexia, as this study pointed out. But there's such a huge amount of knowledge that we don't know that we really could study. And it's a very cheap alternative to what we currently have. It's something that's readily available to anyone, anywhere, possibly. As long as you just have your hands or a voice, you can study rhythm, you can study music, and being able to do this, we can add so much to our therapeutic repertoire. And I kind of want to look, if you look at this flute on the right, to kind of help understand how beneficial music is and how mysterious it is. Music, as I said earlier, is an ancient art. It predates even language itself. And one of the oldest instruments found to date is a 50,000-year-old flute that's made out of a cave bear bone. And this is it. But scientists that have studied this flute have all come to the same conclusion that even this flute is at such a level of complexity that it's not the first of its kind. It had to go through many renditions even to get to this. It has 4 holes, and it's even able to follow the tonal distinctions that we use today. So there has to be some reason that music, as ancient as it is, has survived this long throughout human history. And it gives you more meaning than me just trying to psych myself up before a 12-hour study session. And so again, there's so much more that we can get from this. And I want to bring this discussion to an end and open up for any type of questions that you might have. And I want to thank everyone again for joining me on this. And I hope that you all got something out of it. But if not, there's so much more to get out there that I'm sure eventually we'll all catch up to it. But there we go.
Thank you so much, student Dr. Bishop. Great presentation. If anyone has any questions, feel free to either raise your hand on Zoom or just unmute and start talking, or you can type in the chat if someone's having mic issues.
This is Kirby. Thank you, Brandon. That was really interesting. Of course, I didn't understand half of it, but I could tell that it was interesting. And, as I told you before the talk, well, I wanted to find out more about your background and if you're interested in pursuing research on music as therapy and this interaction. I think that would be wonderful. And I also wanted to just comment that, right, I have dyslexia. And I recently found out that some people like myself, when I am in silence most of the time because it makes it easier for me to think. And I recently found out that for some of us, our brains make musical patterns out of white noise. So you may be thinking like, oh my God, I'm hearing music and there's no music playing. But apparently it's that all the white noise electricity crap going on, your brain tries to make sense of it by making it seem like music. Did you know that? It's so weird. And I wonder if it's connected.
Did not know that. I've always heard people say, there's no such thing as true silence. Even if you're in a room with no sound, you're going to hear your own heartbeat. You're going to hear your own blood moving.
And that is disturbing. It is so weird to hear your pulse. I hear my pulse. Oh, I hate it.
It is. And once you hear it, it's like deafening. That's all you can hear because it's so loud. But, even to some, I think that pulse is a rhythm. Ironically enough, if you sit with a song and it has a nice strong beat to it, give it 5 minutes or so, you'll find that your pulse will actually match that. A lot of times you can put on a song with a good beat to it that has a steady pulse, and your heartbeat will match that. It'll start to slow down or speed up to match that rhythm. Music really has a profound effect on the human body. There's a movie on Prime that shows this guy. He walks into a home with dementia, and he puts headphones on a man who's had dementia for a decade almost, and he doesn't say anything. He listens to music that he used to listen to when he was a teenager for about 20 minutes, and they take it off and they ask him, how you doing? And he could speak. He had his entire life. He was lucid. He could talk. He knew who he was, his memories. He told them what he used to do and play. And it's amazing. So it really is a unique. Says my internet is unstable. Is anyone on there? Can you all hear me?
We can hear you. You're cutting in and out just a little bit, but I think you're back now. You're frozen for a second, but we could still hear you.
Okay, perfect. Thank you. So I hope that answer. I don't necessarily know why the brain does that, but I believe it.
Hi, student Dr. Bishop. We're so excited to see you on your third year. For everyone on the call, Dr. Bishop was our big in Cobb, and now we are also Comm students. So half credit goes to Dr. Bishop. We love you. But I find it interesting that the study was starting in Italian, which is a Romance language, which are notably like more fluid languages. So what do you think the segues are for English, and how do you think English, since it's a much more staccato, stopping sort of language than Romance, how do you think that fits into the narrative of the story that they're trying to piece together?
Like I said, I think one of the aspects of what they were trying to do to take out variables was to attack musicality instead of music itself. So they were trying to study those innate elements of music. You know, if you can just tap 4 and if you can repeat after me, asking the brain to process those rhythmic elements that exist through all, I guess, languages and all forms of music, regardless of culture. Now, I will say that music, especially today, if you move outside of pop, is very European heavy. Even as a saxophone major, which was made in France 150, 160 years ago. It's an extremely new instrument compared to the rest of them. Most music is coming from that part of the world. Anything that's considered high order or college that you want to learn or something is going to be based off of techniques that are from Europe or Germany, Italy, Austria, even American music outside of pop. They pull most of their techniques from that part of the world. So I think that even with English, there is some benefit, especially since English is such a mixed language that has so many different rules and so many different inflections in it. I want to say a Germanic language. Correct me if I'm wrong, but English itself can be very fluid. It can be very hard. And so I think as far as English goes, you might get some benefit, but that's also one of those things that you would have to study. It's one of those variables within the study that still has to be, I guess, taken control of.
Are there any other questions?
I have one.
Go ahead.
Sorry, student Dr. Bishop, so student Dr. Epps. I wanted to get your, I guess, idea or theory about how successful do you think that this study would be instead of doing the rhythm tapping if, say, we incorporated the voice, such as, like scatting or just vocalizing, I guess, necessarily to the beat. Do you think that that would enhance the movement and perhaps even result in like a faster, I guess, success? I don't know a better way of putting that question.
Truthfully, I think that I can't say whether it would enhance, change or decrease, but the picture that didn't come up when I was going through my slides was actually a picture of the brain and some areas that have already been mapped out that deal with different aspects of music. For example, the rhythm tends to activate different areas of the parietal system. Timbre activates different areas of the occipital or the frontal lobe. Pitch can activate different areas of the temporal lobe. And so I think that any aspect of music, whether it's singing, following a rhythm, playing an instrument, as long as you're addressing those innate elements, you're going to be activating those areas of the brain and strengthening those types of connections. There is a school in New York. It's called the let's see, it's called the Special Music School, and it's publicly funded, but there's also a stipend for every student to learn music from kindergarten up to 12th grade, paid for by the Kaufman Center. And they teach each of these students different musical instruments. And collectively, all of these students tend to score higher on higher than average on all of their tests, including science and math, reading, standardized tests. And so I think if we were able to look at, whether it was the resources or the teachers and kind of move all of that out, each of these students learns a different aspect of music or an instrument. And so I think that kind of supports that regardless of the instrument, there is some benefit to music, just learning music in itself. I hope that answered a little bit of your question.
It did. Thank you.
Any other last minute questions? Looks like you just have a comment in the chat. That was someone else's question. These have been some really great discussions and really great questions, everyone. So I appreciate you chiming in and chatting about it.
I had one last question, unless someone taps in after this. Sorry, I'm in the gym, but with dyslexia kind of, well, what I would imagine being kind of attributed to maybe effects in the frontal lobe, or I guess that lateral aspect, like Broca's area, Wernicke's area, would the things that you hit on with pitch being activating the occipital lobe, or rhythm activating the temporal lobe, would you notice some sort of association with things that target the frontal lobe in music also maybe addressing the dyslexia or helping, like people with dyslexia, do they find that the aspects of music that hit those areas of the brain kind of make it more comprehensible? I don't know if that question makes sense.
I think I get what you're saying, maybe.
Okay, sorry. Okay,
say,
let me try.
No, you're good.
Let me try. Okay, so like, and I don't remember the specific like associations you had named, but I do know, like you had mentioned, like pitch, like you said, activating my occipital lobe and things like that. So would, if say the dyslexia was attributed to like the Broca's area in the frontal lobe, with certain aspects of music that also tapped into the frontal lobe, kind of like would people with dyslexia have better associations with those aspects of music, I guess? Or I guess like rhythm stands out more because it hits the frontal lobe, and dyslexia also affects the frontal lobe. Or like pitch stands out more, like different aspects of music that might affect that aspect of the brain. Like, do you notice there might be any associations with that in people with dyslexia?
I can't say for sure. I won't be able to directly answer your question. I have read up on other studies where people that were given music training, their brains were analyzed before and after this training, and you could see tangible differences in the amount of neurons and the sizes of structures due to the music training. And so I think there would be some difference and some aspect of, say the frontal lobe with dyslexia that would change with the music training. There was also a study done on pitch changes. If I play two pitches back to back that are the same, most people will say they're the same. If I play two pitches back to back and I change one, the second one up or down, then you might, most people would still say that, they could hear the change and they could say whether it was up or down. But for people that have had temporal lobe epilepsy and they've had, say, their right temporal lobe, part of it taken out, this ability to detect that change in pitch was actually lost. And so I think if I'm getting your question correctly, there is a difference in the, I guess, the neurological structure of certain different areas of the brain when it comes to these disorders and how music can affect them. Does that kind of touch upon what you were asking?
It does. Thank you so much.
Mm-hmm.
Any other questions? If not, thank you so much again, student Dr. Bishop. That was a great presentation.
Thank you all for coming, and it really made my day. Have a great weekend, everyone.
You too. Bye, everyone.